If you're over 50, your body is going through a powerful chemical shift that makes pain, stiffness, inflammation, and digestive problems much more likely. This is not just about getting older. It is happening deep inside the body. Many seniors are told that these changes are normal and that pain, swelling, and low energy are simply part of aging, but the real truth is far more complex. Have you ever noticed that the older you get, the harder it becomes to fight off inflammation, even when you try to live a healthy life? Could there really be an easy and affordable way some seniors are using to support their joints, digestion, and breathing that almost nobody talks about? And what if the same method that helps one person could be dangerous for another if used the wrong way? And what if part of that problem is not old age at all, but an internal chemical imbalance that most people never get tested for? In this video, I'm going to show you how seniors are using baking soda to support their health, what the science says about it, the safe ways it has been used, and the people who should never try it without medical guidance. By the end, you'll understand how something so simple can have such a powerful and unexpected connection to the way your body feels and functions over time. Before we get into it, can you do us a quick favor? Like this video and subscribe to join our healthy community. Also, type yes in the comment section now so we can see how many of you are interested in this type of video. All right, let's get started. The powerful health benefits of baking soda. First, supports joint health and helps fight inflammation. As the years pass, the body does not always move the way it once did. Simple actions such as bending down, gripping objects, or standing after sitting for a long time can begin to feel slow and uncomfortable. Hands may feel stiff in the morning, knees can ache without warning, and the hips may lose some of their natural flexibility. These changes often appear gradually, making them feel like an unavoidable part of aging. In many cases, however, the real cause is long-term inflammation and an internal imbalance that builds up in the body over time. When the internal environment becomes more acidic, joints are placed under extra stress, which can lead to swelling, soreness, and a steady loss of mobility. This is where baking soda, also known as sodium bicarbonate, may offer gentle support. As a natural alkaline substance, it helps neutralize excess acid in the body and creates a more balanced environment. A more balanced pH level may calm the inflammatory processes that contribute to joint pain, stiffness, and discomfort. In a 2018 study published in the Journal of Immunology, researchers found that drinking a solution of sodium bicarbonate increased anti-inflammatory cells while reducing overly aggressive immune activity. This shift may be helpful for conditions like rheumatoid arthritis, where the immune system mistakenly attacks healthy joint tissue, causing pain and swelling. Some seniors, with the guidance of a healthcare professional, choose to use small, carefully measured amounts of baking soda mixed in water. Over time, many report feeling less stiffness and more ease in their movements. It is important to understand that this is not a cure, but a gentle way to support the body's natural balance alongside a healthy lifestyle, proper medical care, and light physical activity. Next, relieves heartburn and acid reflux. Naturally, heartburn is a problem many older adults know all too well. After meals, a burning sensation may rise from the stomach into the chest or throat. Sometimes it is mild, and other times it can be strong enough to interfere with sleep and daily activities. This happens when stomach acid moves upward into the esophagus, a condition known as acid reflux. As we age, the muscles that keep acid in the stomach can weaken, making heartburn more common and more frequent. Baking soda works as a natural antacid because of its alkaline properties. When mixed with water and swallowed in small amounts, it can neutralize excess stomach acid almost immediately. This chemical reaction helps reduce that uncomfortable burning feeling and restore a more balanced environment in the stomach. For this reason, sodium bicarbonate has been used for generations as a fast-acting home remedy for occasional heartburn. This effect is also supported by science. A review published in the journal Gastroenterology and Hepatology explains that sodium bicarbonate is recognized in the medical field as a fast-acting agent for neutralizing stomach acid, providing rapid but short-term relief from heartburn and indigestion. Many seniors use half a teaspoon to 1 teaspoon of baking soda in a glass of water and sip it slowly when symptoms appear. It is important not to use this remedy too often, as baking soda does contain sodium and can affect blood pressure and fluid balance in some people. Those with heart or kidney conditions should always consult a healthcare professional before using it regularly. Next, supports kidney health. As the body grows older, the kidneys often do not work as efficiently as they once did. For many seniors, this can lead to a gradual buildup of acid in the blood, a condition known as metabolic acidosis. When too much acid stays in the body for too long, it can place extra stress on the kidneys, speed up their decline, and contribute to fatigue, muscle weakness, and bone problems. Managing acid levels becomes an important part of protecting kidney health in later years. This is where sodium bicarbonate, commonly known as baking soda, can play a helpful role, but only under medical supervision. Baking soda is a natural alkaline compound that can help neutralize excess acid in the bloodstream. By lowering acid levels, it reduces the burden on the kidneys and may slow the progression of chronic kidney disease in certain individuals. A well-known study published in the Journal of the American Society of Nephrology found that patients with chronic kidney disease who received sodium bicarbonate experienced a slower decline in kidney function compared to those who did not. Their blood bicarbonate levels improved, and they were less likely to reach advanced stages of kidney failure as quickly. Some doctors prescribe controlled amounts of sodium bicarbonate to patients who need help maintaining a healthy acid-base balance. However, this is not something to take lightly. Baking soda contains sodium, and too much can raise blood pressure and cause fluid retention, especially in people who already have kidney or heart problems. This is why it should never be used regularly without guidance from a healthcare professional who can monitor the body's response. Next, improves oral health for aging teeth and gums. As we age, our teeth and gums need extra care. Enamel naturally wears down over time, gums may recede, and the mouth can become more vulnerable to harmful bacteria. These changes increase the risk of cavities, gum disease, and persistent bad breath. Maintaining a healthy mouth is not only important for eating and speaking, but also for overall health, as oral bacteria can affect the heart, lungs, and digestive system. Baking soda has long been used in oral care because of its gentle yet effective properties. It works as a mild abrasive, helping to remove surface stains from teeth without being overly harsh when used correctly. Its natural alkaline nature also helps neutralize acids in the mouth that are produced by bacteria in certain foods. These acids are one of the main causes of tooth decay and enamel erosion. By balancing the pH in the mouth, baking soda creates a less favorable environment for harmful bacteria to grow. Scientific research supports this benefit. A study published in the Journal of Clinical Dentistry found that toothpaste containing baking soda was significantly more effective at removing plaque and reducing bacteria than toothpaste without it. This means regular, gentle use may help protect aging teeth and gums, reduce inflammation in the gums, and support fresher breath. Many seniors choose to brush lightly with a small amount of baking soda once or twice a week in addition to their regular toothpaste. When done gently and in moderation, it can help keep the mouth cleaner and brighter without causing damage. Next, may boost energy and reduce muscle fatigue. Many people make an effort to stay active, whether that means walking, gardening, stretching, or doing light workouts. While movement is incredibly important for healthy aging, it can also bring muscle soreness and faster fatigue. Muscles may burn or feel heavy sooner than they once did, which can discourage physical activity and reduce overall quality of life. This discomfort is often linked to a buildup of lactic acid in the muscles during movement. Baking soda is known as a buffering agent, meaning it can help neutralize excess acid in the body, including lactic acid produced during muscle use. When taken in very small and controlled amounts, it may reduce the burning sensation in the muscles and help delay the point of fatigue. This allows the body to move a little longer and more comfortably. A meta-analysis published in the Journal of Strength and Conditioning Research found that sodium bicarbonate supplementation improved performance and reduced muscle fatigue during short, high-intensity physical activity. While seniors may not be sprinting or competing, the same buffering effect may still provide gentle support for everyday movement and exercise. Some older adults under professional supervision use a very small dose of baking soda mixed in water before light physical activity. However, too much can cause stomach discomfort, bloating, or changes in blood pressure because of its sodium content. This is why it is essential to start low and always follow guidance from a healthcare provider. Next, may help with urinary discomfort. Urinary discomfort is something many seniors, especially women, experience at some point in their lives. The burning sensation when urinating, the constant urge to go, and the feeling that the bladder is never fully empty can be both painful and frustrating. These symptoms are often caused by urinary tract infections, irritation, or an overly acidic urinary environment. As the body ages, the urinary system can become more sensitive, and the natural balance of bacteria and pH in the bladder may be easier to disturb. Baking soda may offer gentle support in easing this discomfort. Because it is naturally alkaline, it can help reduce the acidity of urine when taken in very small, carefully controlled amounts. When urine becomes less acidic, the burning sensation may ease, and the environment may become less welcoming for certain types of bacteria to grow. This is one reason some people use baking soda as a supportive remedy alongside proper medical treatment. A study published in the Japanese Journal of Urology observed the effects of sodium bicarbonate in women suffering from recurrent urinary tract discomfort. The researchers reported that reducing urinary acidity helped relieve symptoms such as burning and irritation in a number of participants. These findings support the idea that balancing pH levels can play a role in improving urinary comfort. It is important to understand that baking soda is not a substitute for antibiotics when an infection is present. UTIs can become serious if left untreated, especially in older adults. Anyone with ongoing pain, fever, or blood in the urine should seek medical care right away. Baking soda, if used at all, should only be considered as a supportive measure and with guidance from a healthcare provider. Next, supports breathing and sinus comfort. Breathing issues are common as we age, especially during cold and flu season or when allergies are present. Seniors may experience a scratchy throat, nasal congestion, sinus pressure, or thick mucus that is hard to clear. These symptoms can make it difficult to sleep, speak comfortably, and even enjoy food. Over time, repeated congestion can also increase the risk of infections in the sinuses and chest. Baking soda may help support breathing comfort when used as part of a warm water solution for gargling or nasal rinsing. Its mild alkaline nature helps soothe irritated tissues and create a less acidic environment in the throat and nasal passages. When mixed with warm water and used as a gentle gargle, it can calm the throat, reduce irritation, and help limit the growth of certain harmful bacteria in the mouth and upper airway. It may also help loosen thick mucus, making it easier for the body to clear it out naturally. Research published in the Journal of the American Dental Association has shown that sodium bicarbonate solutions can reduce microbial growth in the mouth and throat, which can be helpful during mild respiratory irritation. This is one reason baking soda is often included in oral care and throat-soothing remedies. Some seniors also mix a small amount into a saline nasal rinse to help clear blocked sinuses and ease pressure without the strong side effects of some medications. While baking soda can be gentle and helpful, it should never be inhaled as a dry powder, and the solution should always be properly diluted. Those with asthma or severe breathing conditions should consult a healthcare provider before using any home remedy. Next, helps in teeth whitening. As we get older, our teeth naturally lose some of their brightness. Years of drinking coffee, tea, and other dark beverages, along with certain medications and natural enamel thinning, can leave teeth looking dull or yellow. For many seniors, this change can affect confidence and the desire to smile freely. While professional whitening treatments and store-bought kits are available, they are often expensive and may cause sensitivity, especially in aging teeth and gums. Baking soda offers a much gentler and more affordable option. It works as a mild abrasive, which means it can help polish away surface stains without using harsh chemicals. Its fine texture helps lift stains from the outer layer of the teeth while being less damaging than many commercial whitening products when used correctly. At the same time, baking soda's alkaline nature helps neutralize acids in the mouth that can weaken enamel and contribute to discoloration. This creates an environment that supports both a brighter and healthier smile. Scientific support for this effect appears in the Journal of Clinical Dentistry, where research showed that toothpaste containing baking soda were significantly more effective at reducing surface stains and plaque than those without it. This reduction in plaque and staining can gradually improve the brightness of teeth and promote better overall oral hygiene. Some seniors choose to gently brush with a small amount of baking soda once or twice a week, usually after regular brushing with toothpaste. It is important not to scrub too hard or use it too often, as excessive use can wear down enamel over time. Next, treat foot calluses. Foot calluses are a very common problem for seniors. Over the years, repeated pressure and friction from walking, standing, and wearing shoes can cause the skin on the feet, especially on the heels and the balls of the feet, to become thick, hard, and rough. While this is the body's way of protecting itself, these hardened areas can become uncomfortable and even painful. Cracked heels and thick calluses can also lead to infections if the skin breaks, which is why gentle and consistent care is so important as we age. Baking soda can be helpful in softening and loosening tough, dry skin on the feet. When added to warm water, it creates a soothing soak that helps relax the feet while gently breaking down the thick layers of dead skin. Many seniors find relief by soaking their feet in a basin of warm water mixed with a few tablespoons of baking soda for about 15 to 20 minutes. During this time, the skin begins to soften, making it easier to gently rub away rough areas with a soft washcloth or pumice stone. Baking soda also has mild antifungal and antibacterial properties, which can help keep the feet cleaner and protect against infections, especially in people with diabetes or poor circulation. A report published in the International Journal of Dermatology has mentioned the softening and cleansing effect of alkaline salt solutions, including sodium bicarbonate, on thickened skin areas. This gentle action supports healthier skin renewal without the harsh effects of strong chemical foot treatments. After soaking, applying a natural moisturizer like coconut oil or a fragrance-free lotion helps lock in hydration and keep the skin soft for longer. Consistency matters more than intensity, so gentle treatments done regularly work best. Next, relieve itchiness from bug bites and stings. As we get older, the skin often becomes thinner and more sensitive. This can make bug bites and stings feel even more irritating than they did in younger years. A simple mosquito bite can turn into hours of itching, redness, and swelling. In some cases, scratching can break the skin and increase the risk of infection, which is especially concerning for seniors whose skin heals more slowly. Baking soda may help bring gentle and natural relief to this kind of discomfort. When mixed with a small amount of water to form a paste and applied to the affected area, baking soda works by soothing the skin and helping to neutralize irritating substances left behind by insect bites and stings. Its mild alkaline nature can calm the skin and reduce the urge to scratch. Many people notice that the itching and burning sensation decreases within a short period of time, allowing the skin to relax and begin healing. Scientific support for this effect can be found in skin research. A study published in the International Journal of Dermatology discusses how alkaline compounds such as sodium bicarbonate can help soothe irritated skin and reduce inflammation on the surface layers. This makes it a helpful, low-cost option for managing minor skin reactions caused by insect bites. To use it safely, a small amount of baking soda can be mixed with clean water to create a gentle paste. This can be applied to the bite for several minutes and then gently rinsed off. The skin should always be clean, and if there is intense swelling, severe pain, or signs of an allergic reaction, such as trouble breathing, immediate medical attention is necessary. Next, may help inhibit toenail fungus. Toenail fungus is more than just a cosmetic issue. For many seniors, it becomes a persistent and frustrating problem that makes the nails thick, yellow, brittle, and sometimes even painful. Because circulation in the feet can slow down with age and the immune system may not respond as strongly as it once did, fungal infections are often harder to clear. Warm, damp environments inside shoes provide the perfect conditions for fungus to grow and spread, especially when the skin is already fragile. Baking soda may help in this area because it changes the environment that fungus needs to survive. It is naturally alkaline, and most fungi thrive in moist, acidic conditions. By creating a less acidic surface, baking soda may make it harder for the fungus to continue growing and spreading. Some people use it in foot soaks or apply a small amount of a baking soda paste to the affected nail and nearby skin. Over time, this may help reduce odor, moisture, and discomfort in the area. A study published in the journal Mycopathologia found that sodium bicarbonate showed the ability to inhibit the growth of several fungal strains in laboratory conditions. While this does not make baking soda a guaranteed cure, it does support its potential role as a gentle, natural aid for managing fungal growth. It is important to note that stubborn or advanced toenail infections may still require medical treatment, especially for seniors with diabetes or circulation issues. Next, may help treat canker sores. Canker sores are small but incredibly uncomfortable. For seniors, they can make eating, drinking, and even talking feel painful. These tiny ulcers often appear on the inside of the lips, cheeks, or tongue, and can be triggered by stress, weakened immunity, minor injuries, or acidic foods. As the mouth becomes more sensitive with age, healing may take longer, turning a small sore into a lingering problem. Baking soda may help ease this discomfort by gently neutralizing acids in the mouth that slow down the healing process and increase irritation. When the mouth becomes too acidic, it creates an environment where sores can remain inflamed and painful. Baking soda balances the pH in the mouth, helping to calm the tissue and reduce irritation around the sore. Some people use it as a mild rinse by mixing a small amount into warm water, while others create a light paste and apply it directly onto the sore for short periods. Research published in the Journal of the American Dental Association has demonstrated that sodium bicarbonate solutions can reduce oral acidity and support a cleaner, less irritated environment in the mouth. This can help minimize discomfort and promote faster healing of minor oral lesions, such as canker sores. Baking soda is also gentle and unlikely to cause the harsh stinging that some commercial treatments do. Finally, provides relief to skin issues. Aging skin goes through many changes. It becomes drier, thinner, and more prone to irritation, blemishes, and uneven texture. Seniors may notice increased sensitivity, occasional breakouts, rough patches, and a dull appearance that was not there before. Finding a gentle, affordable, and natural way to care for the skin can be especially helpful during this stage of life. Baking soda, when used carefully and in moderation, may support healthier skin by helping to balance its surface pH and reduce the buildup of oils, dirt, and bacteria. Its mild exfoliating effect can gently remove dead skin cells, allowing fresh, new skin to appear more clearly. At the same time, its anti-inflammatory properties may help calm redness and minor irritation. This can leave the skin feeling smoother, softer, and more refreshed. Research published in the Journal of Dermatological Treatment notes that sodium bicarbonate has mild antimicrobial and soothing properties when used in low concentrations on the skin. These qualities can support clearer pores and reduce certain types of irritation, which may be beneficial for aging skin that is prone to sensitivity. Some seniors choose to mix a very small amount of baking soda with water to cleanse the face once or twice a week. It should always be used gently and followed by a moisturizer, as baking soda can be drying if overused. It is important to avoid daily use and to stop if any irritation occurs. Who should be careful? Even though baking soda is natural, affordable, and widely available, it is not safe for everyone. This is especially important for seniors, whose bodies often respond more strongly to changes in sodium levels and pH balance. Baking soda contains a high amount of sodium, and too much sodium in the body can increase blood pressure, strain the heart, and place extra pressure on the kidneys. For someone already living with high blood pressure, heart disease, or kidney problems, this can turn a helpful remedy into a serious risk. People who have been told to follow a low-sodium diet must also be very cautious. Even small, regular amounts of baking soda can interfere with that dietary restriction and push sodium intake above safe levels. The same applies to individuals taking medications that affect salt, water balance, or blood pressure. Combining baking soda with certain medications may increase the risk of fluid retention, swelling, shortness of breath, or changes in heart rhythm. There is also a concern for pregnant or nursing women, as disrupting the body's natural acid and electrolyte balance can affect both the mother and the baby. In addition, Using baking soda in large amounts or for long periods can lead to a dangerous condition called metabolic alkalosis, where the body becomes too alkaline. This can cause confusion, muscle twitching, nausea, and even more serious complications if not addressed. If you are a senior and considering using baking soda regularly for health purposes, it is extremely important to speak with a healthcare professional first. A simple conversation and, in some cases, a blood test can help determine whether it is safe for you. Let's wrap it up. Baking soda is one of the most overlooked health tools in the world, especially for seniors, but only if it's used the right way. From supporting joint comfort and reducing inflammation to easing heartburn, improving oral health, and helping with breathing and urinary discomfort, this simple white powder has more power than most people ever realize. Small mistakes, overuse, or using it without guidance can make the difference between a helpful remedy and a risky choice. That's why understanding when, how, and if you should use baking soda is so important as we age. Seniors around the world are already using it to feel better, move more easily, breathe deeper, and stay more comfortable in their daily lives. It's affordable, easy to find, and when used wisely, it can quietly support your health in ways that many expensive products cannot. Sometimes the most powerful remedies aren't hidden in a pharmacy or behind a prescription. They are sitting right on the kitchen shelf, waiting to be used with care and knowledge. If you found this helpful, go ahead and like this video and subscribe so you don't miss more tips on simple, natural ways to support your health as you grow older. Have you ever used baking soda for any of these purposes, or are you planning to try it? Share your thoughts and experiences in the comments. We'd love to hear from you. Thanks for being here and spending time with us today. And if you'd like to keep learning, we've selected 2 more videos just for you. Click on one of them and I'll see you there.